Every 1 in 4 persons globally is likely to get a stroke. Men, women, and even children are reporting to the stroke unit of a Korle-Bu Teaching Hospital, defying the long-held stereotype that only older people get stroke. Neurologist Dr. David Broddie-Mends says the youngest case the unit has had to see is a 13-year-old boy.
Incidence of stroke does increase as you grow older, but we've noticed that younger and younger people are getting strokes. We have very busy lifestyles, we're having more stress, we're having higher levels of hypertension. I think the youngest person that we've had here with a stroke has been 13. So people even as young as 13 can get strokes. You're not too young to have a stroke.
He speaks about causes of a condition and why it is not one for only older people.
There are certain things we call risk factors that make people more likely to have strokes. The most common one is high blood pressure or hypertension. Because as you can imagine, if you have blood moving in a closed system, which is our blood vessels, and the pressure is high, there's a high likelihood that there will be some changes or some accidents that will happen to the vessels. It happens in the brain, then it's called a stroke. Other things can also cause strokes like diabetes or high blood sugar. High cholesterol levels can also be risk factors for strokes.
Survival rates for stroke patients depend on a number of factors, including the type and the kind of a care patient gets. The more comprehensive the care, the higher the chance of survival. I have come to the Korle-Bu Teaching Hospital to meet 51-year-old stroke survivor Johnson Deity. He is here to see the doctor as part of his bi-weekly review sessions, having been struck by the disease in January this year.
I started having increasing of high BP. The next thing that I knew was that I was gone. When I came back to myself, actually, I was told that I was a dead person. That is what my relative told me. My big sister told me that I was longer than the bed that I was lying on. I was huge. My head was big. It was just a dead body that was on the bed.
Unlike many stroke survivors, Johnson can walk freely without aids. He has no visible disability.
My wife told me that they have to start everything with me like a baby because I could not walk. I could not do anything. I have to be bathed. I was put on Pampers. I can easily go lose myself, just spoil myself. They have to clean me up. It was so much.
We'll see you in about a month's time.
All right.
Dr. Broddie-Mends and other specialists here at the Korle-Bu Teaching Hospital have been working to rehabilitate stroke patients like Johnson.
One of the most important things that go into survival will be the type of stroke and then how quickly the person comes to the hospital. Because the quicker you come to the hospital to receive medical attention, the higher the survival rate. And then also the type of stroke. If you have a very large stroke affecting a large area of the brain, survival definitely will be less than if you have a small stroke affecting a small area of the brain. Other things that go to affect survival is, one of the common things is infection. If you have a stroke and it's affected your ability to move or your ability to swallow, then you have a high risk for infections. So maybe the stroke itself doesn't kill you immediately, but because you can't swallow, and you try and take some water and it goes the wrong way into your lungs and you get an infection in your lungs, or you're in bed for a long time, you're not moving, you get sores and ulcers and they get infected. Those can all add to the risk of dying from a stroke.
At the stroke unit, patients on admission are receiving care from care nurses and other medics. It is a very uncomfortable place to be, seeing patients unable to help themselves at anything, lying helplessly on the sick beds. But Johnson looks back to his days in this unit and is thankful he is alive.
Where I was, anyone that was brought around where I was lying, died. So about 5 people who were even around you, who came to sleep beside your bed and in front of you, everybody left. So me like this, I could not make friends till I came back home. I don't know those who were there. Even the nurses, I don't know those who were there. It is after I came back that I could see that I saw this person somewhere. I saw this person somewhere. But I don't make people out.
He wants people to pay attention to their bodies and report any abnormalities as early as possible. Dr. Broddie-Mends believes prevention is the best cure. However, early detection could also increase survival chances.
The risks are your high blood pressure, if you have high sugar diabetes, or if you have high cholesterol levels. So you need to know, you need to check. So you need to go to a hospital and be screened. And nobody is too young to have a stroke. And then also watch your diet, take more fruits, more vegetables. These things have been shown to reduce the chances of stroke. And then exercise.
There are many who are not as lucky as Johnson Deity. Some have died, others have been permanently disabled. But there is hope. The stroke unit of the Korle-Bu Teaching Hospital is on a campaign to increase awareness of a deadly disease and draw attention to the risk factors and triggers as well as treatment options. As I leave the unit, shaking by the revelations, I am advised to check my blood pressure count. Well, I am fine according to what I'm told. Are you? As the world marks Stroke Day on Tuesday, October 29, the caution is, live your best life. You are not too young to be struck by stroke.